In Part 1, we talked about how anxiety shifts from protection to overactivation. In Part 2, we looked at how that overactivation shows up as chronic worry, panic attacks, or social fear. Now, let's look at what's happening underneath. Because anxiety isn't just a feeling, it's a pattern in the brain and nervous system. And understanding that pattern helps explain both why anxiety feels so powerful and why recovery is possible. At the center of anxiety is a small but powerful structure called the amygdala. You can think of it as the brain's alarm system. Its job is to detect potential danger and activate a response quickly. When functioning properly, the amygdala activates when something genuinely threatening appears. A loud noise, an approaching car, a sudden movement. It signals the body to prepare. Heart rate increases, breathing quickens, muscles tense. That response is protective. But in anxiety disorders, the amygdala becomes more sensitive. It activates more easily, and sometimes without clear external danger. Neutral situations can be interpreted as threatening. A social interaction, a physical sensation, an uncertain outcome. Over time, this repeated activation strengthens stress pathways. The brain becomes faster at detecting threats, but slower at calming down. The prefrontal cortex, the part of the brain responsible for rational thinking, planning, and emotional regulation, normally helps evaluate whether a threat is real. It acts like a calming influence. It asks, is this actually dangerous? Or is this discomfort? In chronic anxiety, communication between the amygdala and the prefrontal cortex can become less efficient. The alarm activates quickly, but the calming response struggles to catch up. Stress hormones, like cortisol and adrenaline, circulate more frequently. Sleep becomes lighter. Muscles remain tense. The nervous system stays in a state of vigilance. This is not permanent damage. It is a neuroplastic adaptation. The brain adapts to what it repeats. If stress is repeated daily, the stress response strengthens. But here's the important part. Neuroplasticity works both ways. If anxiety pathways can strengthen, they can also weaken. Cognitive behavioral therapy helps retrain exaggerated threat perception. It teaches individuals to identify distorted thinking patterns, to challenge catastrophic predictions, to gradually tolerate uncertainty. Exposure-based therapies do something powerful. They allow the brain to experience feared situations or physical sensations without avoidance. Over time, the amygdala learns. This is uncomfortable but not dangerous. Repeated safe exposure weakens the alarm response. The prefrontal cortex regains influence. Functional brain imaging studies often show decreased amygdala overactivation after successful treatment. Connectivity between regulatory regions strengthens. That's measurable recovery. In some cases, medication supports this process. Selective serotonin reuptake inhibitors, SSRIs, and other medications help regulate neurotransmitter systems involved in stress processing. They don't erase anxiety, but they can reduce baseline sensitivity, making therapeutic work more accessible. Chronic anxiety doesn't only affect the brain, it affects the body. Digestive issues, muscle tension, headaches, sleep disruption. Over time, chronic stress can strain cardiovascular and immune systems. That's why early intervention matters. Reducing chronic activation protects both emotional and physical health. Recovery from anxiety doesn't mean never feeling anxious again. It means the alarm system activates appropriately and turns off appropriately. It means the body can calm down. It means uncertainty can be tolerated without spiraling into catastrophe. It means social interactions feel manageable. It means panic no longer dictates behavior. The nervous system relearns balance. The brain restores regulatory strength. And the longer stability is practiced, the more natural it becomes. Anxiety disorders are common. They are medical conditions involving brain circuitry. They are not character flaws. They are not personal weakness. And they are highly treatable. If anxiety is persistent, overwhelming, or interfering with daily life, seeking professional evaluation can be transformative. Early recognition reduces long-term stress burden. Treatment reduces symptom severity. And over time, the brain reflects that change. Treatment works. The nervous system can relearn calm. Balance can be restored. Support changes outcomes.